Parliamentary Secretary to the Minister of International Trade.
Thank you very much, Mr. Speaker. Merci beaucoup. I'm glad to be speaking to you here in Ottawa from the unceded territory of the Algonquin Anishinaabe people. My riding of Parkdale High Park that I'm proud to represent in this chamber rests on the traditional territory of the Haudenosaunee, the Wendat, the Métis, and most recently the Mississaugas of the Credit. Toronto is now home to many First Nations, Inuit, and Métis people. Mr. Speaker, these past 22 months, it goes without saying, have been defined by a global pandemic, COVID-19. But these past 22 months have also been defined by exemplary work on the part of healthcare professionals working extremely hard to keep all of us safe. So the very first thing I want to say in terms of addressing Bill C-3 is to say thank you. A very heartfelt and sincere thank you to all of those healthcare professionals who have been doing so much for all of us in our time of need. I'm speaking of doctors, I'm speaking of nurses, I'm speaking of auxiliary health staff, I'm speaking of researchers who have brought us vaccines. I'm speaking of the people in my riding of Parkdale High Park, at St. Joseph's Hospital, at the Parkdale Community Health Centre, at Four Villages, at Runnymede Rehab, all of the countless nurses, practitioners, doctors, and other healthcare professionals who call my riding home. I'm speaking also very personally of my wife and her team at the Public Health Agency of Canada. I've spoken about Suchita before. She has the distinct duty of, during this pandemic, being in charge of quarantine and border health controls for the Public Health Agency for all of Ontario and for the North. It is a critical job at the simplest of times, but during a pandemic, it is a pivotal job for what we do in keeping all of us safe. So thank you, Suchi, for what you've been doing consistently for these past 22 months. What all of these people deserve is our appreciation, our gratitude, and our respect. Yet things have unfortunately been inverted in these last several months. Those who should have been receiving praise are receiving scorn. Those who should be empowered to keep us safe are being actively prevented from entering hospitals and clinics. They are sometimes being threatened, harassed, or even assaulted. It extends beyond just those who provide health care, Mr. Speaker. It also applies to those who are seeking health care. Patients themselves are being intimidated and prevented from entering into some of these healthcare facilities. The impact, Mr. Speaker, is severe. Healthcare professionals feel they've gone from heroes to villains, and it is indeed demoralizing.